What is hand-arm vibration syndrome? Historical overview. 1862, Dr. Maurice Raynaud first described fingertip blanching triggered by cold exposure, later termed Raynaud's disease or Raynaud's phenomenon. 1901, Hutchinson proposed that Raynaud's phenomenon was a more accurate term for this vascular condition. 1918, Hamilton reported that 89% of 34 foundry workers exhibited symptoms of what was later called vibration-induced white finger, VWF. 1929, Lewis recognized that Raynaud's phenomenon could have various underlying causes. 1932, Allen and Brown established classification criteria to distinguish between primary Raynaud's disease and secondary Raynaud's phenomenon. 1986, the term hand-arm vibration syndrome, HAVS, was introduced to replace the narrower term VWF, reflecting the broader range of vascular, neurological, and muscular effects from vibration exposure. HAVS is a disorder caused by vibration transmitted to the hands through direct contact with vibrating tools, surfaces, like control panels, or equipment, such as steering wheels and trucks. It results from the physical transfer of vibration from machinery or tools to the hand and arm. HAVS can affect the vascular, blood vessels, neurological, nerves, and muscular, muscles, systems. These systems may be affected simultaneously or individually. Vascular effects. Decreased blood circulation to the fingers. Fingertip blanching, whitening of the skin. In advanced cases, blanching may progress to a cyanotic, bluish, discoloration. In severe instances, tissue damage can lead to cell death and gangrene. As the vibration frequency increases, blood flow to the hands and fingers decreases. Vibration exposure can lead to demyelination, which is the loss of the myelin sheath that surrounds nerve fibers. Myelin plays a crucial role in protecting nerves, electrically insulating each fiber, and speeding up nerve impulse transmission. Because myelin is non-regenerative, once it is damaged, it cannot be repaired. Prolonged vibration causing demyelination results in slower and weaker nerve signal conduction due to the loss of this insulation. This often presents as numbness or tingling, pins and needles, in one or more fingers. Symptoms may initially be mild, affecting just the fingertips, and may come and go. In severe cases, numbness may become permanent and extend along the affected fingers, leading to clumsiness, difficulty with fine motor tasks, and a reduced sense of touch. Vibration can also damage the Pacinian corpuscles, sensory nerve endings that detect pressure and vibration in the fingers. These corpuscles generate nerve impulses when stimulated and help monitor vibration. Damage to them can cause tingling, numbness, and other abnormal sensations known as paresthesia. Muscular effects. Sensations of numbness or tingling, pins and needles. In advanced stages, muscle strength and tactile sensitivity may decline. Grip strength often decreases due to a combination of muscle and nerve damage caused by vibration exposure. Joint stiffness. Finger joints can become stiff, limiting the ability to fully flex or extend the fingers. This stiffness can interfere with tasks requiring full finger mobility. Reduced range of motion. Individuals may experience restricted movement in the fingers or wrists. This loss of flexibility results from both neurological and musculoskeletal changes associated with HAVS. Percussive pneumatic tools operating at approximately 30 Hz may be a primary contributor to bone and joint disorders. Vibration exposure has also been associated with the development of other occupational conditions, including carpal tunnel syndrome, hearing loss, vibration white foot disorder. Other musculoskeletal outcomes have been associated with hand-arm vibration, including bone cysts and osteoporosis in the hands and wrists, osteoarthritis of the wrist, elbow and shoulder, epicondylitis and nonspecific muscle and joint pain and stiffness. Raynaud's versus HAVS. Disease versus phenomenon. Raynaud's disease occurs independently and is not linked to any other disease or condition. It is the more common form, also known as primary Raynaud's syndrome. affects only the vascular system. Raynaud's phenomenon develops as a result of an underlying condition, such as scleroderma, lupus, or myositis, certain medications, or lifestyle factors like workplace vibration. Also referred to as secondary Raynaud's syndrome. Raynaud's syndrome, a general term that can refer to either the primary, disease, or secondary, phenomenon form of Raynaud's. It is important not to use the two terms interchangeably since they have differing causes and effects on the hands. Compensation systems sometimes use the terms Raynaud's and HAVS interchangeably, but they are distinct conditions. Raynaud's is more commonly caused by other diseases or medications, whereas HAVS results specifically from prolonged exposure to vibration. Accurate diagnosis requires proper medical testing and a thorough occupational history to differentiate between the two. Raynaud's primarily affects the vascular system without neurological involvement. HAVS can impact the vascular, neurological, and muscular systems of the hands. It is important to avoid using these terms interchangeably, as their causes and effects on hand health differ significantly. For more information, please contact an orthodontist.